We want to shift gears now, still in the realm of public health. Let's talk about measles. This is something we've been following for a while now. We got an update recently that 8 new measles cases have been confirmed in South Carolina, all linked to the Upstate area, the outbreak there. So right now we're getting an update from Department of Public Health there in South Carolina on the latest on this outbreak. So far statewide, 33 cases of measles statewide. Let's take a listen to what's being said.
Getting that up to at least 95% to bring us that herd immunity that protects those who cannot be vaccinated. It protects those from illness. And so that's really our ultimate goal.
All right. And Lauren?
Hi, Lauren Saucer, KFF Health News. Have you all, have any hospitalizations related to any of these cases been reported?
We do not have any reports of hospitalizations among the cases that we're aware of.
Thanks.
All right. Baker?
Yeah, kind of a two-part question. I noticed that the locations for the mobile unit have more recently been situated in the northern part of Spartanburg County. Does that indicate that that is where the outbreak is occurring most? And then my kind of second question is the nature of the quarantine and how strict it actually is. I mean, I understand that keeping kids out of school is a strong approach and something that can be coordinated with school officials. But you know, what's in place to, I mean, what's the likelihood that kids still go to church, still go to play dates, still play in the neighborhood, things that, you know, are not inside of school?
So thank you. To answer your first question, we have scheduled the mobile health units in locations that we believe are convenient to the community in Spartanburg County in general. We're not necessarily trying to locate those closest to where the cases have been identified, because those people can live in a wider area. So not necessarily scheduled to be close to the cases. We want it to be convenient to everyone in the Spartanburg County area, and they're finding reasonable locations to serve that need. As far as the quarantine, what we make clear in the guidance that we provide to those who have been exposed to cases is that they must, that we are requesting that they comply with quarantine, meaning that they exclude themselves from activities not only in schools, but that they do not interact in any group activities, in any public settings, in any after-school activities, if these are students. So we are pleased that these individuals who have been placed in quarantine, that they are complying. And that, again, what we're recognizing is that we are only seeing cases among those in quarantine and not additional spread in the community, which would indicate that people are not complying with the quarantine recommendations that we're providing.
Gotcha. Thank you.
All right. And we've got one in the chat from Carrie Beal with Fox Carolina News. She asks, according to the CDC, measles was eliminated in 2000, but some say the U.S. may lose elimination status. Can you explain what that is and where we stand?
Yes, we were successful in eliminating measles transmission in the United States 20 years ago because of the effectiveness of the MMR vaccine. And what that elimination means is that there's not ongoing transmission in the United States in a 1-year period. And so when the initial outbreaks began in other areas of the United States earlier in this year, we are looking at the risk of losing that designation of measles elimination if we continue to see transmission beyond a year, community transmission, meaning not imported cases, that continue a year after the outbreaks first began occurring. And so this is a great concern that we will have lost that huge public health success in eliminating ongoing disease transmission in our communities in the United States. And again, a reason that we absolutely want to stop these outbreaks as quickly as we can so that we can keep measles transmission from continuing in our communities in South Carolina and elsewhere in the United States that poses a risk for people who are traveling in the states or traveling here locally.
All right, and Skylar?
Hey, Skylar with the Daily Gazette. Just wanted to see if you could give any update on the number of students who are still being excluded from school activities. Are we still at that 139 number, or has that changed?
So the total number that we currently have in quarantine is there are 27 people who are currently quarantining of those who are exposed to measles cases.
All right, and it looks like Tom has another question.
Thanks. So I heard another public health official address this recently, and I'm trying to remember if you have addressed it, but the concern is that there may be people who aren't getting kids vaccinated because they think, oh, well, just let them get it, they'll be fine, and then they'll have the immunity that way. I don't know if you've encountered that argument recently, but do you want to go ahead and address that?
Well, we are aware that some people may not consider the seriousness of measles, and they may believe that natural immunity is something that they should rely on, and that can result in illnesses that can have complications. And so the risk that people rely on natural disease to get immunity means that people can have the complications, especially in young children, of developing pneumonia. That's a leading cause of death in children. So be aware of the consequences of the risk of hospitalizations, the risk of long-term neurologic impacts on children. Some of these can be immediate with the infection. Some of these can actually be far remote from the infection. So the belief that this is not a serious disease, that you should just let it take its course, can result in as many as 3 to 5 children who get measles. That these can result in hospitalizations, these can result in deaths. So that is that idea is just it's such a serious concern that people may take that risk because we have certain risk groups, but nonetheless we can't predict who might have those complications even in previously healthy individuals. So for those reasons, it is a great concern that some people do are considering that.
All right, and Lauren?
Hi. I'm hoping you can talk about sort of some of the reasons behind the historically low child vaccination rates in this part of the state. You hear a lot of people talk about misinformation that's spread on social media. Obviously, we have very well-known public officials who have expressed skepticism about vaccines. But what role do you think providers have played into this? Do you think that there's a culture among some pediatricians in the Upstate that prioritize personal choice over the benefit to the whole community when nearly everyone is vaccinated? And
Well,
are there specific providers that you all are concerned about?
Well, we believe that our healthcare providers are among the one of the strongest and most trusted in terms of providing accurate information about the importance of people staying up to date with the recommended vaccines, because they understand not only do they provide these preventive services, but it's also these providers who take care of people when they're ill. And so they have a very in-depth understanding of the complications and things that I mentioned. And there are multiple factors that contribute to this decline in immunizations that any one person who's making that choice for themselves or their children could be different. I think it is a combination of the things that you've mentioned. There is as has been mentioned, some people believe that this is not a serious disease, a misperception in that, and they take the risk of getting the disease naturally. Misinformation and disinformation through social media and other channels has a significant impact on people's the information that they believe in and that they trust in. And so all of those are factors in our declining immunization rates. But I do believe that our healthcare providers, that we continue to rely on them not only to provide the vaccination services, to care for those who are ill, and to provide that guidance to those that they are providing services for that. To help them make informed decisions about the best vaccination choices for their patients.
All right, and Skylar?
Hey, sorry if you said this and I just missed it, but for people who are quarantining because they were exposed to the measles, how long does that quarantine last?
The quarantine period is 21 days from the last exposure, because that's the maximum that someone could still become, could incubate out, could develop infection after exposure, is as long as 21 days.
And Jessica?
Hi, thank you. Jessica Nix with Bloomberg News. I was wondering if you're able to trace the outbreak in South Carolina to other outbreaks in the U.S. and where this one might have originated from. Thank you.
Yes. So while we don't have the source for the existing chain of transmission that we're seeing with these outbreak associated cases, we do have the ability to do genetic sequencing of the viruses that are isolated from those for whom we have obtained samples. And we can match those genetic isolates with circulation of measles in other places of the country to see the relatedness of the strains. So while we may not be able to identify where the initial community transmission began, we can make linkages by the genetic strains to see if these are imported from other areas of the world or if they match the strains that circulating in other parts of the country.
All right, and then Baker?
Yeah, on the public information and education side of things, are you all distributing literature in Spartanburg County and where? And if so, I'd be interested to know what languages those communications are in, and also if you have dispatched, public health workers or officials with your department to schools and churches to raise awareness and maybe, break through any misinformation or myths or just answer questions.
Yeah, so we are distributing information in Spartanburg County. We're also distributing that information statewide, making it available on our website for, as I mentioned, the resources on our DPH webpage that is guidance about measles, guidance about about recognition of symptoms. We have sent communications through school nurses statewide. We have sent communications to the schools that have been impacted specifically. We are providing talking points. We are providing fact sheets that are translated into Ukrainian, into Russian, into Spanish. And whenever we identify cases in where English is not their first language, we always translate those materials to whomever we're trying to reach. We are doing outreach, more specifically in the Spartanburg area, with our community health workers, our outreach workers, to partner with community-based organizations, with the faith community. And so those are just some of the examples of the variety of ways we're putting information out in a variety of languages through social media as well, on our website, through handouts, through and other types of releases.
Great, thank you.
All right, we've got a question in the chat from Nick from WBTV. He asks, is this outbreak expected to impact other South Carolina school districts? And with that area of the upstate being a tourist and holiday attraction, are there any plans to prevent spread?
Well, our plans to prevent spread are to continue to work on increasing our vaccination coverage, because we cannot anticipate where exposures might occur. It is also a concern that we're coming into the holiday season where more people are traveling, whether that is traveling to join family members within the state, or whether people are traveling in other parts of the country where they are actually having, in some areas, higher rates of measles transmission. So the risk of exposure on commercial carriers, on common carriers, exposures in airports, all of these are things that we are working to advise people. We know that getting vaccinated early is important because it can take about 2 weeks to get full exposure from some vaccines. And I'm speaking broadly now about actually all vaccine preventable diseases. This will put us at risk for flu, for COVID, all sorts of respiratory illnesses. And we have to understand that it can take your body a while to mount an effective response. So, there is the concern of transmission in the rest of the country, increased travel during the holiday season, and this is why, again, we're concerned that there can be transmission in other places of the state, and we're hoping that we can best prepare for that through prevention.
All right, and Erica?
Hey, hi, it's Erica Edwards with NBC News. I wanted to follow up on the genetics testing that you talked about, Dr. Bell. Are you finding any similarities between what's happening in the upstate versus what happened in West Texas, for example? Seeing any sort of links between your measles spread and other outbreaks across the country? Thank you.
Yeah, and I don't believe that we have the genetic matching information back yet that brings it to that sort of specificity. So at this time, we don't have information to specifically tie it to these other areas at a level where we have a sort of, I'll just call this, in my terms, it's species-specific genetic typing.
All right, and it looked like Lauren had a similar question in the chat, so I think that answers hers, but Lauren, follow up if not. We've got another one from Alyssa Young from Spectrum News. She said, officials in Texas predicted that measles would spread to South Carolina. Were you all aware of this? Were there any preparations in place before measles started to spread in the upstate?
I apologize. Can you repeat that question for me, please?
Yeah, she said, officials in Texas predicted that measles would spread to South Carolina. Were you all aware of this? And were there any preparations in place before measles started to spread in the upstate?
I don't know that Texas officials specifically said it would spread to South Carolina, or they were probably perhaps referring more generally that it could spread from Texas to anywhere, as with any of these outbreaks, with importations and travel, as I mentioned. But because we were aware of these outbreaks in other parts of the country, we most certainly did have response plans already in place before even our imported cases were recognized. So we had in place our outbreak investigation guidance, how we would conduct contact tracing and identify exposure. So all of those plans were in place, as well as with our capability to do laboratory testing. And so in short, the answer is yes. We absolutely had preparedness plans for the potential that we would see measles here in South Carolina based on what we were seeing in other parts of the country.
Thanks, Dr. Bell. And we have another question from Nick in the chat. He's asked if we expect there to be an impact on any other school districts in the state.
Well, I think, as I've said before, measles can spread anywhere. It does not observe our administrative districts or what have you, our county lines or what have you, where we have lower vaccination coverage or any people who are unvaccinated, measles can pop up anywhere in the state because of importations. And when I say importations, I mean it can be imported from Spartanburg County to other places in South Carolina, or it can be imported from other places in the United States or other countries. So whether or not we are expecting to see it in any school districts specifically, the answer is yes. Whether we are concerned that it may pop up in our communities outside of a school, the answer is yes. And so we are anticipating that possibility because we don't have adequate vaccination coverage in many areas to bring us that herd immunity to protect us all from the potential from measles exposure.
All right, and it looks like Erica has another question.
Hey, thank you for the opportunity for a follow-up. I just wanted to make sure that I'm understanding correctly the timing of your genomic testing when it comes to these cases, and whether they are related, in fact, to the West Texas outbreak, because we are coming up on the deadline of measles, losing our status of measles elimination. So if you could just talk a little bit more about that, that would be awesome. Thank you.
I don't have that information at hand as to whether or not genetic sampling, genetic testing has been completed on samples that we have submitted to link those to what is the genetic profile that has been identified in Texas or in other parts of the country at this time.
So you send those samples to CDC, or how does that work?
The CDC actually sends those samples to another reference lab that is performing that genetic sampling. And so I apologize.
All right, so you're watching Live Impact News on WCNC Plus. I'm Nick Servant. Right now, we're hearing from officials from the South Carolina Department of Health on measles cases. Update. You see the information right there on the side panel on the left of your screen. Total number of cases, more than 30, all within the Upstate area. So we're getting an update there. We've been listening in and checking in on the latest.